couple of weeks ago, wrestling superstar Edge made a surprise return back to the ring after being forced to retire a number of years back with a condition that caused narrowing and pinching on his spinal cord. Welcome back everyone to your #1 source for learning about everything related to sports injuries and sports medicine news. In this video, we're first going to talk about cervical spine stenosis, particularly as it relates to professional wrestler Edge. And then I'm also going to share my thoughts on what exactly went down here at his return and why I was so frustrated watching this happen. Even if you don't know anything about professional wrestling, I'm going to talk about spinal stenosis first, which is a condition we can see in a lot of different athletes. Make sure you're subscribed if you like watching this type of content and want to stay up to date with my future videos. Let's get started. Now, the brief backstory here on Edge is that he was forced to retire back in 2011 after developing a condition called cervical stenosis in his spine. He had had a previous injury that required a fusion in his neck, and then after developing persistent neurologic symptoms, particularly in his arms and hands, he was unable to be medically cleared and was forced to retire. Edge then underwent a second surgery about a year later and was thought to be done with wrestling before coming back just a couple of weeks ago, surprising everyone. Spinal stenosis is a narrowing of the spinal canal that can cause compression on the spinal cord and can either be congenital, meaning someone naturally had it from birth, or more commonly can be acquired over time. The bones throughout the spine are called the vertebral bodies, and there's a specific canal called the spinal canal where the spinal cord travels through. The spinal cord is surrounded by cerebral spinal fluid to give it some cushioning and protection, and then all the different spinal nerves exit off the spinal cord through these holes in the vertebral bodies, and then go out to control the muscles in the arms and the legs. Stenosis means narrowing, and so spinal stenosis is when there's a narrowing of that spinal canal that basically pinches and pushes on the spinal cord, which, as you can expect, can cause dangerous neurologic symptoms. Depending on where this stenosis occurs, you can have symptoms in your arms or in your legs, particularly pain, weakness, numbness, and tingling, and can even lead to the point where you can become paralyzed. Edge's first surgery was an ACDF, which stands for anterior, meaning front, cervical discectomy and fusion. Edge had a 2-level fusion, meaning 3 different bones in the spine were fused together, in his case the C5, C6, and C7. The surgery is done to stabilize and decompress the spine to limit any neurologic symptoms, and basically they remove the discs between the vertebral bodies and then put plates on the front side of those bones to stabilize it. Now, the troubling thing that can happen after any fusion in the spine is what we call adjacent segment disease. After you fuse different levels of the spine, you change the forces and biomechanics in the levels above and below, which results in faster arthritis and degeneration of those levels, and can lead to progressive problems above and below the level of your fusion or adjacent. What likely happened with Edge is he developed some adjacent segment disease from his fusion that then caused that thickening and narrowing of his spinal canal, leading to the cervical spine stenosis. Now, unfortunately, we don't know the specific surgery that Edge underwent the second time he went under the knife. It certainly could have been extension of his fusion, but it could have also been other types of surgery to relieve any neurologic symptoms. So why did doctors prevent Edge from being medically cleared? And just in general, how do doctors handle whenever someone has a fusion and has cervical spine stenosis and is trying to get back to athletics? Remember that the fundamental concept of spinal stenosis is narrowing of that spinal canal. So one of our tools as doctors is to look at the imaging to try to get a sense of how narrow that spinal canal is. In 1996, a measurement was introduced called the Torg-Pavlov ratio, which was measured by looking at someone's x-rays of their neck, trying to get an indication of how narrow their spinal canal was. You essentially measured the distance of the spinal canal and then divided that by the distance of the vertebral body to get an overall ratio. A ratio of 1 is considered to be normal, and a ratio of less than 0.8 was considered to be positive or high risk of having a narrowed spinal canal. Now, there's unfortunately a number of problems with this measurement. For one, it doesn't have very good positive predictive value, meaning if we find it on someone's x-rays, that's not a very good indication that they're going to have future neurologic problems. So when MRIs came along, we had another method to look at this called the CSF functional reserve. In a normal spine, there's cerebral spinal fluid that sort of bathes and goes around the spinal cord, helping to protect it. When you have spinal stenosis, that fluid gets pushed away, and so you can tell now in this image how it looks like the spinal cord is basically being pinched on. Having low functional reserve can be another risk factor for an athlete having neurologic symptoms with spinal stenosis. We also have to consider if someone's had a fusion of the bones in their neck when it comes to clearing someone to play. The majority of criteria says that if someone has a 2-level fusion, like was the case here with Edge, that is a relative contraindication at play, but not an absolute contraindication. But now if someone has a 3-level fusion or higher, that would be a contraindication to play. Now, bringing all this back around to Edge, it's really hard to know exactly what those conversations were with the WWE doctors and between him in terms of the risks of coming back in wrestling based on what was going on in his neck. I don't know the specifics of how all that is done with medical clearance and how much of it just falls on the athlete once they're explained the risks of the situation. So this could be something that's handled differently from any of the major sports we otherwise see. Either way though, it's hard for me to imagine a scenario where Edge had extension of his fusion in the neck and would have still been cleared to play just because of the significant danger it would pose him. The risk here is that whenever you have that spinal stenosis, if you have any sort of injury to your neck, you're at a much, much higher risk of having more permanent damage and injury to your spinal cord that could cause you to be paralyzed. So then 2 weeks ago, we see Edge make his return, and this is where I was a little bit frustrated watching all this go down. Now look, I know that wrestling is done for entertainment, and I can't really take all of this 100% seriously, but it still was hard to watch all this happen and kind of the events that transpired, knowing what we know about Edge's medical history. So as you guys probably saw here, he came out, Randy Orton came out, and then just proceeded to attack Edge. He first took him down to the mat, and then he hit him over the back with a chair. He then had his head kind of sandwiched between 2 chairs and was pressing on it. And then at the end, hit that chair down, and yeah, I know he didn't actually make contact with his head. He just had the chair at the proper angle, but really kind of put a beating on him, as staged as some of this might be. And then at the end here, we see them come out and put him on a spine board and put a cervical collar on his neck, pretending like he had had some new nerve injury. And yes, I know this is done for entertainment and we can't take all this 100% seriously, but whenever this is all being done with someone who has a fusion in their neck and a history of real, true, high-risk medical problems, it's hard for me to not be frustrated seeing this whole situation kind of mocked on TV. Nothing about this sequence changed from the first time that Edge was taken down to the end when they finally decided he should have a C-collar put on and be spine boarded. I would assume and hope that they had some sort of code words or way of going about knowing if he was truly having symptoms in order for Randy Orton to stop and actually take care of his health. But knowing what we know about Edge's history, I feel like they can't necessarily take it to this extreme, because in my mind, it minimizes the real risk that someone like Edge could have by putting his body on the line and going back and wrestling. Now, I'm sure hardcore wrestling fans watching this are going to disagree with me, and I want to hear your feedback. I want to hear your thoughts on this whole situation below. Do you trust in the doctors that had cleared him? Do you think it's dangerous for him to be out there? Does this make you upset watching this? Or are you perfectly fine with it and just entertained? Let me know too if you guys have any other questions about spinal stenosis or any other athletes this might have happened to. Thank you as always for watching the video, and I'll see you guys in the next one.